board meeting. We will call to order the open session, and if I could ask General Counsel to provide a report of actions taken in closed session.
Sure. Thank you, Chair McGarry. There were only 3 items heard in closed session. Item that was originally agendized as 5.3, trade secrets, was pulled, so that was not considered. First item, 5.1, the closed session minutes was approved on a 5-0 vote. Item 5.2, liability claim. The claimant being Joan Pennington, claim against Tahoe Forest Hospital District. That claim was rejected on a 5-0 vote. And then the medical staff credentialing, those recommended credentialing decisions were approved on a 5-0 vote as well. And that concludes my report.
Thank you very much. Item 9, do we have any deletions or corrections to the posted agenda? From the audience?
Sarah, did we have that correction?
That was in the closed session. Or do we have an?
It was in the minutes.
The minutes. That's not for the agenda.
Oh, correct. Oh, sorry.
We good?
We're good.
Okay. Item 10, do we have any audience input this evening? Hearing none, seeing none. Moving quickly through the agenda. Input from employee associations. Hearing none, seeing none. Item 12, President and CEO monthly highlights. Anna Roth.
Good evening. Good evening, Chair and members of the community and staff who are joining and those who are watching. Happy New Year. It is January, and I'm here to talk about some monthly highlights. I actually want to start by calling up Dylan Crosby, who I did send a message out last month, but we actually have been, as you know, focusing on improving our access, and one of the key metrics on that is third next available appointment. Though, sneak preview, a spoiler alert, there will be many more coming in the future weeks and months. Dylan has agreed to lead what we're calling a system redesign team, which will be focused very specifically on improving the third next available. And I will let him talk about he has recruited some friends and colleagues to do that work, and he's just going to give a very quick update. And he'll talk a little bit about where we are. And you kind of can see where we are, but there's a lot of activity that's also going on. So, hand to Dylan.
Thanks, Anna. Good evening, board. Dylan Crosby, VP of Facilities and Construction. Feel very blessed to have the opportunity to be part of this team. We do have Debbie Stanley and then Forhad as well, who's joined with us on our strategic redesign mission. We're hyper-focused on the third next available and achieving that goal. And we're deeply working. We've only been stood up for a couple weeks, so we've integrated and collaborated with the access to care effort that has been going on with a couple years, as well as our working to support ongoing process improvement. So at this point, we're really in a team collaboration, team development, as well as developing additional analytics and really building in to a support structure to partner with our providers, our medical staff, our operational leadership, and really help focus and drive the third next available and promote access to the health system.
Thank you. Any questions for Dylan?
I have a question for you, Dawn, and I'm happy to hear you're going to be working on this. Sorry. So looking at this timeline here, is this realistic that by June we'll be at 30?
Our initial efforts have been really getting up to speed again, just going live in a couple weeks. We have pulled a ton of analytics. In that, there's some early opportunities that we've seen, but we haven't yet been able to forecast and measure what type of improvement that would be. And a huge step that we have not been able to do is really sit down with our providers and our clinical groups and really partner on those improvement activities. So to be completely frank, is I don't know at this juncture, but we are putting a ton of resources, time, and effort and focusing on this very, very diligently. We've actually set up a team room in Reno. We have staff dedicating multiple days to just this topic and providing the support and resources to really drive improvement and assist everybody to achieve this goal.
Well, it
Well,
looks,
for clarity, is that what's being proposed? Is that we're there by June?
That is our annual goal.
Okay.
But given the trajectory, it's going in the right direction.
right.
Yeah, it does typically trend and dip, and hopefully we can avoid that uptick that typically happens late April and June, and try to flatline and drive that down.
Well, it looks aggressive, but
Yeah.
hopefully it'll come by then.
Is Vizient still involved in any way?
Do you want to comment?
Vizient is not, we are not working with Vizient, and we did have, as you know, we had a director of performance improvement. They departed, so that is, I think, one of the reasons why I think we feel so grateful for this team to sort of stand up. They are really filling the gap. I will say, Dylan, Debbie, and Farhad were specifically sort of added into this process. There's many people working on it. They have very specific views. Dylan is sort of builds buildings and kind of knows every aspect of kind of the operations, because you kind of have to go in and learn that to build a building for workers. And so he has a very special skill in that. Debbie knows how to every pathway to make an appointment. And obviously you all know Farhad, who has, unmatched analytics. So these are really force multipliers to a lot of the work that's already going on. We are, do you want to talk about, we are looking at potential, like some additional expertise. The other thing I would just point out about this particular group is some or all of them, actually, all three of them have either gone to the NUCA system or Virginia Mason or both in some cases. And Dylan is, and his team are exploring possible partners. And I think the most recent group that they have been talking with is the group that did the transformation of the Virginia Mason outpatient system. So the truth is, though, is that you can't purchase transformation, so we'll have to do it ourselves. So it'll be our staff that'll really be at the lead, and I think we're really grateful to Dylan and his team and to all the people who are working on this across our system. So it is a very aggressive goal, and it's a lot of hard work, but I feel really confident in this group.
Is some of our success in improving this factor reliant on getting new buildings built and new doctors' offices finished, and both in the Gateway Center and then the Rite Aid and over in Tahoe City, or is that going to come later?
Our aim and immediate approach has really been from all angles. I think there's a sense of optimization that can happen. I think there's a sense of redesign. So you can, their next available is a supply and demand calculation. So there are a lot of levers to pull. And it's very nuanced to get into all those levers, but we are really trying to look at every aspect of that. In addition to that, in setting up the future is, or forecasting the future, we are trying to look ahead, forecast the demand so that we can adequately meet the supply, so we don't see a jump to this magnitude and we can sustain this. So it is immediate fixes, it's also sustainable fixes and trying to forecast into the future.
Dylan? I just really quickly, this is my seasonal PSA to say, we do have, good news is we have 2 new ventilators and 2 new BiPAP machines that are now just state-of-the-art, current technology, so that's great. And we don't really want to use them. So we just want to say that the influenza is actually on the rise, and actually a much bigger jump than we saw last year at this time. And so we just want to remind people that it's not too late to get your flu shot. And, we do have these new really great equipment and great staff, and we hope you don't need them. We have actually had an increase in admissions in the ICU, but it actually hasn't been for flu. But again, I think we're seeing the numbers, and what we don't want is sort of to just be lucky. We really want to be deliberate in our community, so please get your flu shot. And the top chart is RSV, and again, this is just to kind of put those numbers out there, because this is respiratory season, and we really want people to do all of the preventive things that they can. Again, I'm going to kind of move through some of these quickly because they're in your report, but I do want to say that we have started to provide what are post-birth warning sign alert bracelets. And actually, Jan, our CNO, is here and can you just walk us through those just a little bit? Because this is a precautionary measure in that we know that people, when they are postpartum, this is a vulnerable time in the care experience. And so Jan actually is going to she agreed to talk briefly about this. So thank you, Jan.
Yes. Is this on? Yeah. So we are currently waiting for these bracelets to arrive. We were hoping to have them this week, but we should have them hopefully by the beginning of next week. They're bracelets that are going out across the country. We're not just going to be unique to this. But the thought is there's becoming so many OB deserts with OB units closing, and that there is really been kind of an uptick of seeing what happens to mothers after birth, and they go to an emergency room, and a lot of times in the emergency room, they're treating the person, but they have a headache, and they're like, okay, but you might be a little tired, and you may just, so they're trying to treat the symptoms, but are they really noticing that this person is postpartum, and that it could be something like PIH, which is the preeclampsia. We have seen that already, even since we trained our ER staff in the last, 7-8 months ago. So these bracelets, they're going to ask the patient, which kind of we all have kind of chuckled about, they're going to ask the patient to wear these bracelets for a year after their birth. I think if we could get 12 weeks, we'd be very excited. I don't know that it'll go with all their outfits, so. Yeah. But we're hoping. And then the other thing we're working on with Epic is we're going to have a banner that's going to go across that's going to show anybody that goes into that chart. So like a provider, whether it's family practice or emergency room physician, will be able to see that banner and that they are postpartum within the last 364 days. So we're hoping that that will help us and that we can really treat these patients appropriately.
So, Jan, I was thinking when I saw the alert bracelet, the plastic bracelets that we have that we, falls and things like that. So are these durable bracelets then?
Yeah, they're going to be we've seen people with them on. They're a little bit of a thicker, the ones that you can kind of remove on and off. So they're not going to be like our hospital bands that you have to cut off. We're not going to do that to them. It's a more nice, I don't say it's a beautiful bracelet, but it's a nicer bracelet. Yeah. So hopefully just that awareness.
Yep.
But no intelligence, they're not monitoring anything, there's no sensors, it's just an identification. Okay.
Just to kind of show people that this is a postpartum patient.
Yeah. Right. Live strong, yeah.
Yes, that's exactly what they look like.
Okay.
I think they're called jelly bracelets.
Oh, good.
I just wanted to give a quick update, and actually there's updates even that are more updated than this. Permitting for the navigation center that the board approved partnering and funding, the permitting has actually been completed. The town and the county and the owner are coordinating around the improvements. It is actually anticipated to open February 14th. And this, again, just to remind people, this will be a 6 navigation beds, 10 sort of emergency shelter beds, 7 days a week, 365 days a year. So I just wanted to give an update. So it's even moving faster than we thought it would in terms of, as of this slide, because I did get this update just this morning.
Before you
Yep.
talk about what is happening in the interim without the warming shelters?
Yeah.
That's a great question. Some people are, being transported farther away if there's shelter beds. They're in our ER. The police are moving them around. There really is no options. It's very similar to last year, only not even, and we really have not, we've only had one weather triggered moment, which as you know, that has to be pretty far over on the end of the continuum. So essentially, they're kind of just moving around with public service, which is mostly the healthcare, some of the nonprofits, and the police department.
Thank you.
The agency that's going to run this is headquartered in Reno.
Oh, yes, sorry, and yes, Volunteers of America is in fact
Really?
still going to run it, and they have actually been successful in identifying their management team,
Yeah.
and they're hiring. So there are things that is looking very positive also.
Okay.
Thank you for reminding me of that, Dale. I just wanted to quickly talk about a couple of things. I mean, actually, I'm going to leave the 2 boxes on the left side for Dr. Evans, and I'm actually going to call back up Dylan. But while Dylan's coming up, I just want to thank Sarah. Senate Bill 707 is essentially the update to the Brown Act, and this is really to ensure that we have telephonic and audiovisual real-time access during board meetings. And Sarah and IT and facilities have been working very diligently. It's actually very complicated. It also has to have translation support. So that is coming. The community will start to see us phase in some of those technologies as early as next month, and we'll kind of phase them all in. We will have to have that in place reliably by July. So you'll notice some changes in our board, in experiencing our board if you're coming in virtually. And we hope changes for the better. I'm actually going to hand over to Dylan because I want to just really quickly talk about our community partnership with the wildfire mitigation. And so Dylan, maybe you can just walk us through that really quick, and then Dr. Evans can take us through that.
Yeah, happy to. The Truckee Fire Department has been leading an effort for wildfire mitigation and forest health projects around the community. This year, they focused on what they call the WUI project, which incorporated 70 acres in the first phase. Great opportunity to partner with the fire district as well as other community partners. The 70 acres included Town of Truckee land, Nevada County land, as well as Sierra College. So we partnered with them very closely. We had 20 acres of health system property just to the east side of campus have this treatment done. The treatment included tree thinning as well as removing ladder fuels and then spreading the tree canopy, and kind of dual mandated to protect forest health as well as wildfire mitigation. The district, the fire district, is also planning a phase 2 of this effort. Phase 2 will incorporate the whole hillside on the north side of Donner Pass Road. Accompanied in the area is 40 acres of health system property as well. We're working with them very closely and frankly just really grateful for their leadership and partnership to really help protect the essential resources of our campus as well as adjacent local partners as well. And if you have the opportunity, I'd invite the community as well as the board to go take a look just on the eastern side of campus right above the MacGyver ski hill, I think is commonly referred. Happy to answer any questions if, Sled Hill, excuse me. Yeah.
Sled Hill, okay.
Where the sign says no sledding.
There's signs all over it now not to do it.
Right. So Dylan, our 30 acres will be part of the phase 2, 300 plus acres?
So actually the first phase was 20 acres of health system property. So we already have 20 acres that have been completed. And then we have roughly 40 acres included as part of phase 2, which should be sometime this summer before next winter.
So, Dylan, in August of 2021, Barton found it necessary because of the Caldor fire to totally evacuate their hospital. Had to be a disaster for them, very expensive, and it certainly didn't provide the greatest service to our communities, or their community in that case. When you guys are mitigating that hillside and so forth, there's a lot of trees right in the immediate perimeter of this, along these homes, these wooden flammable homes along the streets around here. Are those looked at too, as part of your fire mitigation efforts?
Yeah, absolutely. So, the project in question is definitely a one-off, that there's significant investment going in on the fire district side for these specific areas. But in addition to that, we partner with the fire district on an annual basis. We inspect all health system properties. We do a ton of vegetation management as well as upgrading of building hardening. So, for instance, closing vents or putting, like spark arresters essentially within vents, cleaning up roof lines, etc. So, all of that is deeply looked at on an annual basis. And in addition to that, we also plan substantially for any type of event to occur as well. We typically do multi-jurisdiction evacuation tabletop exercises. We review those plans with the county. We've actually had a tabletop exercise to evacuate the hospital in this room with, I think, about, I'm going to stretch and say 12 to 15 partners, all the local law enforcement, fire departments, Forest Service, town, jurisdiction. So there is robust planning and mitigation efforts that happen consistently because it is a huge risk to the community at large.
Oops.
So
Yeah. Well, Louis, as I remember last year when we had that fire up there near Coyote Moon, as I recall, you were down here concerned about that. Unlikely it would burn down the hill. Prevailing winds and slopes usually go up rather than down, but nonetheless, it created some fear for the hospital, did it not?
yeah.
Yeah. Well, Dylan could. Yeah, absolutely it did. But, one of the things I just kind of talked to Dylan's strengths in this is we were actually able to get the canopy up quite high there. And so the town actually was very appreciative, as well as the Truckee Fire came and said, ultimately seeing that canopy up so high prevented what would be a much larger fire. So,
Yeah.
Again, great work that's been done here over the many years. So.
Yeah. And just a thank you to all those local partners. I mean, really none of this occurs without that deep collaboration, and the amount of partners and investment going into this is substantial. So appreciate being a part of it, the health system.
Thanks, Don.
And I will say, I was as Dr. Evans is coming up to tell us about the other two, I was at the area managers meeting yesterday, and all agencies thank Dylan as well as Dylan. Apparently, the fire district also has a Dylan, and the two Dylans work together on this project. If you need any sort of fire assistance, just call Dylan. I will have Dr. Evans actually talk a little bit again about our medical director collaborative, as well as just some general public health announcements. And then I just have one other announcement, and then we'll see if there's any questions. So.
Thanks, Anna. So the evidence-based public health, I'll just point out, Tahoe Forest has always been involved in making recommendations about nutrition, vaccinations, doing public service announcements, and doing direct patient engagement. But I just want to make note of the fact that things have shifted this last year pretty significantly in terms of noticing there's disagreement between recommendations coming out of the federal government and recommendations coming from science-based societies such as the American Academy of Pediatrics, the American Heart Association, the American College of OBGYN. And so we're in this different sort of a position where we have to sort of navigate that and help our community navigate what recommendations they should be following. So one recent example of that would be the fact that there's now a curtailed vaccine recommendation panel for pediatric patients recommended by the CDC, a significant reduction of what is recommended for those children, but that is not supported by the American Academy of Pediatrics. So we're having to explain that at a lot of different levels. We have information on our website about that. We are doing public service announcements, and we're reaching out directly to our parents and really all of our patients about what vaccines make sense and that are supported, that are safe and effective. So that's been a significant change, and it puts us in a difficult position, but we're really just leaning on what is the science pointing to do, and that's where we will always land, is what is science say. That's our true north.
I'll just add one thing
Please.
to that, and you could expand on it, but this is not unique to our region, and in fact, we are seeing regional alliances, science alliances form, like the Western State Alliance,
Western Coast Health Alliance.
Health Alliance, and there are other ones in other regions, and so I think, again, just sense-making organizations sort of popping up to sort through the plethora of information.
Yeah. And then on the Medical Director Collaborative, I think we've spoken about this, I put it in my reports before, that we have been gathering our medical directors for the service lines for this healthcare system every 2 months, and we actually have a meeting coming up on the 9th of February. And it's really been a good platform for us to make sure that the medical staff, all the clinicians, have visibility into a lot of things that are happening in the health system. They have the ability to, for example, prioritize some of the projects that we're looking at, IT projects and other things, in a way that they can actually say, this is the most important thing to me, and I think to my practice and to our patients, and just giving them an ability to do that. We're also just looking at how can we learn from each other as leaders to make sure that we're moving in the right direction. We're going to be talking a lot about strategy, service line strategy, and how that interfaces with system strategy on this upcoming meeting. So that's been a really nice meeting to have, and I look forward to having more of those. Yeah, I think that's it. Any questions on those two? Okay. Yeah. Thanks.
And then I just wanted to sort of end with gratitude and an announcement. Also, you'll see that Dr. Gladman can answer all the questions, and since he isn't here, I did want to note, I did just send the board, and I think many of our staff have seen it, maybe in the news, but just an update that we learned today was announced that Barton and Renown have since 1999 co-owned Carson Valley Hospital, and today Barton has assumed full ownership of that facility. So just again, I think this is just some gratitude to our board for supporting us as we go through the True North process, which was really in recognition that on top of all the federal and state, budget and policy things that are going on, the ground is shifting under us right here in the Tahoe region, and we're seeing new entrants into the market and new partnerships form and other partnerships change. And so I just want to express gratitude of your support of us really pausing and really examining how do we want to show up in this new environment. And again, there is a press release out. I sent the board a message about it. We don't know much about this, but and this really is a refining of a buyout of Barton, but they've always had ownership interests, so that we don't expect to see changes in the region. That said, there are a lot of changes going on in the region. So I just want to thank you for that. And if you have any questions, we can either call up Dr. Gladman or I'll be happy to pitch in for him. Yeah, thank you.
I know it's early and we don't know much about it, but after I read that, I wondered, is this an expansion of Barton, or is it a contraction of Renown? And I guess we don't know the answer to that, but I think it will be interesting to watch and see which that might be.
Yeah, I mean, I think today it is both. It is an expansion of Barton and a contraction of Renown, but what the longer plays and how that takes shape in the market, I think we'll learn in the coming months and years. The good news is that it is, clearly a commitment to a community, a critical access hospital in this, a rural hospital in a region that doesn't have access. So we are grateful that, Carson Valley, the stated aim of this is to really ensure that that facility is there for generations to come. And we believe in the power of rural, so we're grateful for that. Yeah. It's a good question.
More a comment. Thank you for your presentation. I think of the patient-physician, patient-clinician relationship is just so important, as you age, or if you have new children and all the questions and concerns that you have, that it is just, it's such an important relationship. So thank you for, starting off today with, third next available on a system-wide approach. Really, what does it take to really redesign a system, have a team to really get people back to their doctors? And I think of the changes we're hearing from the government, we're hearing from other spokes, and a lot that I've heard is says, go talk to your doctor. And if we can get to your doctor, then that answer is taken care of. And then I hear the same bubbling up with service lines. Well, the clinicians at this point need to know what their families need and their parents need to then bubble up to this leadership. So to me, I see it all, and of course, as you ended with, under the forever change thing that happens in this world, the only constant, which is change, to see how can we still manage to keep that visit sacred, that relationship sacred. So thank you. Thank you for your presentation.
Any additional comments, questions from the board?
Yeah, I've got one. I was thinking about this move that Barton announced some time ago about moving at South Shore out of California and across the border into Nevada. So does that change now that they're purchased Carson Tahoe, or do you think they still have those plans?
Oh, they are building a hospital. If you drive over to State Line, that next to DART, the kind of Bevmo thing, there's a construction zone and a flag, and they're definitely well on their way of building their facility. I think it's about 4 to 5 years out, but they are they've broken ground.
And is that with the intent of eventually closing the existing Barton facility in California, or?
We don't know exactly, but I will say Dr. Evans and I actually did do a field trip a few months ago over there, and it sounds like they are going to keep a presence at their original site in California. It will be an outpatient clinic and maybe some step down or long-term care, but the acute facility is moving to the Nevada side, sort of at the base of Kingsbury grade right there. Yeah.
From the audience, any comments, questions? Okay, hearing none. Moving on. Item 13, consent calendar. Just as a reminder, these are routine, non-controversial items, so we acted upon by the board without discussion. However, any board member, staff, or interested party can ask for an item to be pulled for further discussion later in the meeting. With that, any items to be pulled?
I do need to note a correction in the open session minutes of December 18th. Item 16.1 notices Director Wong as making the motion and the second, when it should be Director Wong as the motion and Director Brown as the second.
Wonderful. Noted. Thank you. Hearing none. From the audience, any items to be pulled? All right. Hearing none, seeing none. We'll be looking for a motion to approve the consent calendar.
I'll move approval of the consent calendar with the correction as noted.
And I'll second.
Motion and a second. All in favor?
Aye.
Opposed? All right, approved 5-0. Thank you. a pretty light agenda this evening. Item 14, item for board discussion. We'll have a presentation on the True North 5,000 Voices campaign. Kim, welcome.
Thank you. Good evening. I'm actually going to ask Jen to pull a chair up right next to me.
I'll give Jen my seat.
Okay. So as she gets settled, just let me introduce you to Jen Malone. Jen has been our communications manager here at Tahoe Forest for 3 years. Is that a fair timeline?
Yeah, almost 4 years.
Yeah. And I am incredibly grateful to have her step into the role of what I'm affectionately calling the doer of the True North work. It's not in any means a one-person job, so I have very much appreciated Jen. And even on a broader perspective, the entire marketing and communications team has really stepped up. So we have unleashed Mr. Ted Owens, who already has us on the agenda for the Rotary Club to present in a month or so. So I just really want to start, as Ann often does, with strong gratitude for the fact that our team is really stepping up. And this is another great example of where our organization is coming together to really do the work that needs to be done. So, so I'm super excited about that and grateful to have Jen sitting next to me and Ted sitting right over here. So next slide, if we can. Oh, fabulous, thank you. So I just wanted to start with an overview of what True North is about, particularly for anybody who hasn't heard about it. So we have come up with these 3 sort of buckets of work. The first one is health within reach, and we're sort of talking about that around expanding access, reducing wait times, adding local services that are, within close proximity to where you are, and the possibility for some affordability pilots that we're currently working on. The second sort of bucket is what we're calling peaks of excellence, and that's really about how we strengthen high-need service lines and create system-wide ripple effects. So what can we do in the model of the Cancer Center that serves the next big need for our community? And I think you all know that sort of, ortho is bubbling to the top, but Louie and I do have a little friendly wager about what might come up on the top, so we'll see how that goes. And then transformation. I think all of us would agree that we can't go through sort of these big kinds of projects without putting some infrastructure in place to support them, to support change, to support, the different ways that resources need to be allocated in order to support it. So just a quick reminder that that's kind of the overview of True North and where we're going. So now I want to talk about 5,000 Voices, and I will just mention both the town and the school district are doing current surveys in our community around potential bond issues, and they have hired a consultant called True North. That is not us. We are having no conversation about that at all. So we are really calling this effort 5,000 Voices from now until we actually have a strategic plan, so as not to confuse people around what we're talking about. So 5,000 Voices is what you will hear us talk about as we go forward. And that is really the public involvement process that we're in right now anyway. So, and I have a clicker. So I'm going to ask Jen to talk a little bit about what you see here, and you should have some handouts in front of you as well. So Jen, why don't you take it?
It's nice to see you all. I'm just here to kind of provide a brief outline of our efforts currently. Earlier this week, we were able to launch 2 foundational pieces for 5,000 Voices. We launched the landing page. Right now, it's just a basic starting point that we're hoping to evolve with more content over time. With that, we launched the survey on SurveyMonkey. That piece is built into the webpage, and then we'll be using that QR throughout other print assets that you see. We still have a need to finalize the Spanish version of the survey, but we should be live with Spanish by the 26th. In tandem with that, we finalized the press release, and that is ready to send as soon as tomorrow or as late as Monday. We've curated media lists and community stakeholder lists with the contractor. And this effort will also be duplicated on our website as a news item. Next on the list, we have been in production for an oversized direct mail piece. It's an oversized postcard. I believe you see that up there on the left side of the screen.
This is this one?
It is, yes. And that piece is really created to drive users to our webpage and take the survey. And it's a brief overview of the 5,000 voices and hoping to educate people more with the website. We did a short print run this week for the purpose of proofing and review, and we're working on a comprehensive quote now for the printing and mailing of the piece. And once we have that final mailing list compiled, we are also able to import that list into Meta and Facebook and retarget those same people with paid digital and social campaigns, which is a little ways down the road, but in the plans. Also, with all of these foundational pieces we've built for 5,000 Voices, we'll be building those into all of our communication with email newsletters that we're currently doing. And last couple items, we're working on a video campaign currently. We're storyboarding and concepting that. So we're in the very early stages, but we're really thinking about how we establish the voices for the video campaign. And some thoughts that came to mind for voices that we want to include are executive staff, the board, med staff, employees at large, possibly community members, and hopefully patients. We're kind of moving quickly on that for the first video, but our time frame is to review the first edit the first week of February.
Wow, that is fast.
That is fast.
Yeah. And finally, we're working rapidly to identify events and opportunities to really get out there in front of people. We have narrowed down a pretty nice list of events from Incline to Tahoe City and Palisades that we might have presence at. We can probably report on where exactly we'll be at the next board meeting. And we're building a list of opportunities to meet within each community. But so far, we've secured dates with Truckee Rotary, the Leadership Program with North Tahoe Chamber, and we have leads on several other things with Truckee Chamber, Tahoe City Rotary, the Senior Center, and a couple opportunities in Incline. It's also our intention to hold coffee talks. And that's about it.
That's about it. So it does feel a little bit like this has been a long time coming, but I think you can get a sense of how much work goes into something like this. And it was important for us to really be careful about sort of consistent communication across the consistent messaging across everything that we did. So we took a minute to really think about what we wanted to say. We took a minute to think about what we wanted to ask. We wanted to really make sure that the sort of 5-minute survey that we put together isn't just a bunch of questions we wanted to ask, but that it really drives the decision-making around the 3 buckets that we talked about. And so that's been a big effort, but we are super excited to start to see it roll out across the community, and hopefully you will see it everywhere and anywhere. As Jen mentioned, this is a small run of these postcards, so if you have any comments or suggestions, we are open to them now when we will do our larger run in the not-too-distant future. The mailing that we're going to do is about a $20,000 investment on the part of the health system, which is important to us because the mailers will actually go to the address that people have on their tax records, which means if they're not living here, they will get the postcard wherever their primary address is, and we think that's an important piece in terms of reaching people who don't live here year-round, who are a very important constituency for us. And the contractor, East River PR, that we're working with has also done this work for the PUD and actually had excellent results doing that kind of mailing. So we did, as an executive team, sort of decide that that was a worthwhile investment on the part of this to really make sure that we heard from that group. To build a little bit on what Jen was saying, the list of events and places we will be I think is at 12 pages now, was the last time I looked. It is comprehensive, and we really are very interested in reaching people where they are. I think to have the expectation that people are going to come to us and then do a 5-minute survey is probably not realistic. We need to go where they are and help them in whatever way we can complete the survey or talk with us in whatever way they want. We have unleashed Mr. Owens, and he's going to be out in the community gathering comments for us as well. His relationships will be super important in terms of how we make sure that we reach our partners across the organization. So super, super excited about that. This is a very small, I just wanted to pull some examples of the very different kinds of communication that we will be doing. So by no means is this a comprehensive list, but as Jen mentioned, we're looking at coffee talks, which would be, small groups. We'll be going to the PFAC in February. We will be at the with the medical group on February 9th. We are doing events like the Uller Fest, is that how you say it? So we're doing some large tabling events. We're hoping there's a Tahoe City Breakfast Club. But then as we go a little further out, we're really looking at how we do paid advertising and digital campaigns. So this is where we start to invest a little bit of money. And as Jen mentioned, we can take that mailing list and put it into some of our tools and be really targeted in terms of how we do digital outreach to those folks. So not only will they be seeing it in their mailbox, but they'll be seeing it on their Facebook and, when they go to the news site and the ad pops up. We are hoping to really be everywhere. So those are very, and you can see underneath each one of those opportunities for outreach, the kinds of campaigns we might run. So Shape True North, Your Healthcare, Your Voice, Take a 5-minute survey. We've kind of come up with these different messages that will cycle through so no one message gets too repetitive that people don't notice it anymore. So we will bring back an initial report to the March board meeting in terms of what we're hearing. And we particularly want to do that because it's important for us to parlay this work into our budgeting process. And so by then, the budget process will be well on its way, at least internally, and we will be able to make sure that the folks who are working on that have a good sense of input in terms of what we're hearing, as will you. That said, we will also have a live document that I'm going to show you on the next slide. But before I get to that, I wanted to talk a little bit about sort of how this is going to roll out. So this community input is incredibly important to us, but is only one piece of the work that will happen. So we're already starting to do some work around analyzing the broader market. So the conversation we just had about Barton and Renown is part of that. Obviously, we keep an eye on that. You had the market trend report back in August or whenever that was. Those are super important things. Ted is working on an economic impact statement with UNR that we hope will be available around the May timeframe that will help us to share with the community the kinds of economic impacts we have in this community. And then once we have that information all gathered in the March to June timeframe is when we'll start really putting pencil to paper and using that information to talk about the strategies that will be proposing to you at the July meeting. So then we'll be looking at really how do we do that from a value delivery perspective? What makes sense? What can we do? What can be sustainable? And then the change process takes time, and the change process takes patience, and it takes communication, and it takes support. And then we'll be constantly tracking and doing improvement around these things. So this is a very clean-looking chart, but the reality is that this process can be somewhat chaotic. So we do not at any point expect that this is going to be a linear process. We will bounce back and forth. There will be things that come up that we have to sort of take a quicker path on or slow down on because there are things we need to consider. So these are generally the steps that we anticipate taking in a broad perspective. But again, we will do it very much in response to what we learn, in response to what we hear, and in response to what goes on in our ever-changing world, which, as you all know, is very much ever-changing. So we gave you a sneak peek of our data collection tool last month, and so now I wanted to bring back the actual tool. So if you will pull that up for me, Devin, I would appreciate that very much. So this is what our data tracker will look like. So you will receive a link to this data tracker on Monday. This is not the actual data tracker itself. This is a copy I made because some of the comments that we're tracking, we just want to make sure that we honor, people's privacy. If they don't want their word for word comment to be shared, we want to make sure that that's the case. So the tracker will be available to you all, and it will be available to any staff that are working on True North. So you will go in, and you can just go to the engagement log tab at the bottom and fill in these different pieces of information. It's very easy. So a date, who put it in, where you were when you heard the input, what is the activity or name. So, sometimes, like I filled in this one, we had a comment from the Golden Hour, so, that's the organization, but there isn't really an event or activity name that goes with that. So, just use your judgment. Mostly what we want to be able to know is if we want to go back to an organization, we can track it down. If we have a question about a comment that's put in, we know who to go to. And then we're tracking very closely locations. So Devin, if you can click on that little arrow where it says Truckee, you'll notice that you just can pick one of these things. So if you happen to see a comment about the hospital on your Facebook page, you can go to Digital Online and put the comment in there. And we hope that you really will do that because those are all important pieces of information for us to track. The type of contact that we had, so we anticipated, and I think we talked about this once before, we will get different kinds of feedback from different places. So small group conversations will give us in-depth feedback. Larger group meetings will give us a different kind of feedback. One-on-ones, all these things will give us different pieces of feedback. So we want to make sure that we're understanding where that came from. So the number of participants, in this case, there were about 30 people at the Golden Hour. And then I did sort of just, I actually have a series of comments that I need to put in, but they had a good number of comments that they shared. So, and then any demographic notes that you want to make, and we'll leave that to your discretion in terms of what you think is relevant to the comment, right? So this one, the need for more ECC beds, we can certainly understand that comment coming from a senior group. So I think that kind of context is helpful to us. So that's really the piece that from a logging perspective, we hope you all will really use. There are a bunch of other tabs at the bottom, and those other tabs at the bottom are important for us to be able to sort of suss out themes, to be able to track when we need to get down to incline, when we're doing too much in Tahoe City. I'm just making that all up, but it will allow us to really make sure that we are getting the cross-section of input that we want. So you could just quickly, like if you click on monthly summary, so nothing has been entered yet, so there's nothing there. Is there one to the left of engagement log, Devin? No, okay. Go to board graph, and let's see what board graph has. Oh, yes, there's, okay, dashboard. Yeah, so you'll see where I put in that one comment, so far 30 people were at that meeting. So we're 0.6% of the way to our 5,000 voices goal. But this is really important. This will self-populate, so you don't need to worry about that. And then all the other tabs, the ones that don't self-populate, we will populate for you. So really, the most important piece is just the capturing of what people are telling us. So you will get a link to this. If you have any trouble, please don't hesitate to reach out to me. It should be very easy. It looks a little daunting when you first open it. The first page has some instructions, so if you get lost, you can look there, or as I said, don't hesitate to reach out to me, reach out to Jen. We can easily walk you through that. So with that, I am going to stop talking and see what comments or questions there might be.
I have a thought. My friends and neighbors whine on occasion about survey saturation. Obviously, that's a concern. I think it's fabulous that you have this multifaceted approach, because what turns off some people it doesn't affect others. I'm probably one of the loudest survey critics So I think that's great that you have this multifaceted approach, because obviously some people will respond favorably to you in some cases and others not, so.
I mean, I'm sure I wasn't the only one sitting at the public managers meeting yesterday, listening to the town and the school district and us. And there was one other, sanitation district is doing one too. So I think survey fatigue is real. And I think that's why I'm really sort of hoping that people, you guys and the staff here at Tahoe Forest will get out and talk to people, because I think that's really where the input we get will be the most valuable and where we're the most likely to get it.
So Kim, how many people are going to be using the tracker that you're going to be able to extract information from?
My guess is there'll be about 20 people who will have access to the tracker.
As far as inputting? Okay.
Yes.
Kim, could you give me kind of an understanding of the questions that are being asked through the QR codes? Because that will help me understand sort of the categories of information that you're looking for.
Yes. And I will be sending you questions that you can use in conversations with people or in meetings that you go to. So we are not going to set you free with no sort of constraints around, how to have these conversations. We will arm you with that information. But Jen, are you able to pull up the survey quickly, and we can sort of walk through some of the questions? Not to put her on the spot or anything, All right, so here are some of the questions. Where do you prefer to receive most of your health care? Why do you and your family sometimes seek care outside the Tahoe Truckee region? Do you prefer to receive care in person, virtually, through a mobile clinic? Do you not care? Have you received care virtually or by telephone in the past year? That's a big one that's coming up a lot. Have you or a family member delayed or avoided care because of cost concerns? We feel like we really need to understand what the affordability piece is and how big of an impact that has. Of the following healthcare services, which 2 or 3 do you or your family use the most? So this is kind of broad categories: labs, imaging, physical therapy or rehabilitation, preventative screenings, medications and prescriptions, and then just an other for whatever people might fill out. If we could be exceptional at 1 or 2 new services, which would matter most to you and your family? So orthopedics, geriatrics, surgery, women's health, concierge, other. Which of the following gives you the most confidence that TFHS provides excellent care? So this is one of the things we talk about a lot, right? So board certified specialists, the latest medical technology. You guys get a lot of presentations around accreditations and awards that we receive. We're curious to know how much that affects people's perception of the care that we give. The ability to get quick access gives people confidence, so there's a variety of different things that they can select. What do we not currently offer that you want us to? Looking ahead 5 to 10 years, what do you want us to provide? What should we be thinking about long term? And then sort of, how do you like us to communicate with you? What's your age range and what's your zip code?
Okay.
So there are a couple of other ones there, but generally those are what they are.
Great, thank you, that helps.
Robiny?
All right, I talked y'all into comas.
No. I have a list.
Excellent.
At least one of those questions sort of crosswalks with the community needs assessment. So I don't know if you can count any of those interviews in this process.
We are counting those interviews because that input was valuable and detailed, and we want to make sure, and quite frankly, it's being reported on in a very useful manner, that really gives us some good insight. So I'm working very closely with Maria and Lizzie to make sure that feedback gets incorporated. And the next step of that is to make sure that, so we've put together a community health improvement plan task force that I'm participating on, as is Dr. Darzenkevich. So we want to really make sure that the improvement plan and the strategic planning are dovetailed, right? We the task force chose not to take on the topic of access to care because the strategic plan is taking that on. So instead, the improvement task force is looking at transportation, where it's related to medical care, food insecurity, which was a big one that came up, and then mental health and substance use.
Okay, thank you.
A few questions. You referenced demographics. Are there specific targets that we're trying to reach, and is there the ability and opportunity to course correct, 2 months in, saying we are absolutely missing this audience, we need to pivot?
Yeah. So the plan, the document that we have that is kind of our outreach plan, does identify different demographic groups that we want to make sure we reach, and we can absolutely do that. One of the easiest ways to do that, although we'll see in terms of effectiveness, is the digital and online. We can be super specific in terms of how we do digital outreach. And so when we think about the different audiences that we want to reach, that might be one where we really look to reach to sort of younger people, right? Or, Facebook, I think the demographics of Facebook changed a lot during COVID. So now, that's mostly people my age. So yes, we absolutely will do that. And that's one of the reasons why I really encourage you to put some demographic details in there, is for that very reason.
One, I could not be more excited about this overall process, and it's a huge sort of near-term lift. Is this an opportunity for us as well to create some long-term muscle memory where this is continued on into the future? Maybe not obviously at this magnitude, but creating those channels where we can maintain regular dialogue with the community.
So it would not be our objective that this would be a one-time goal. I mean, I think as we think about the non-existent Office of Strategy right now, the one thing we really think about is, or I guess I should say I think about, since I am the Office of Strategy right now, the one thing I really think about a lot is relationship, right? It's not really about a one-time deal, but it's about how do we build relationship with our partners, with our community. So yes, it's absolutely a way to open the door, sort of in a big splash way, but that door, as long as I'm here, will not close.
Fantastic. You can't go a day without hearing about AI.
Yeah.
Is there, intent to use AI tools? For example, I'm using them in my daily work to not only capture conversations, transcribe those, summarize data.
Yeah.
Are we planning on using those types of tools to?
I already am. Yes. We will explore how we can do that. Just basically the PowerPoint presentation this evening was sort of put together, the content of it was put together in some work I did with AI. And so I think, it's super helpful to take, a variety of different documents and sort of compress them into one presentation. That's been super helpful. So how we make that work with the tracking spreadsheet, I think is something that's still to be determined, that I'm going to learn a lot as we go about that. I might call you for some.
I'd be happy to talk to you. Yeah.
Can I just add on that
Yeah.
to say that is something that you could stay right there, Kim. That is something that we have, it's a great idea, and we'd love to do it, and we do have to understand what the community's comfort level is around consenting, of using sort of digital agents, if you will. Very similar to what we're thinking about in an exam room, too, where, how do we disclose that maybe there's a digital agent, transcribing a conversation and that sort of thing. So, and there are best practices around that, and our communications team is going to be digging through all that. They may actually call you now that you've volunteered.
I am in fact volunteering, yeah. With those concerns noted, and I think, I've just been blown away at how, it's got a ways to go, but this is a massive amount of data. And especially in the conversations, whether those are group conversations, whether those are one-on-one conversations, I found it to be an incredibly effective tool to capture those insights and translate them into some meaningful findings. So I'm glad to hear that's going on.
Thank you.
And the final question for me, just with the sample questions you provided, I know it wasn't the exhaustive list, there seemed to be a big focus on health care, care you're getting here, the care we're providing. I was part of a similar exercise a while back with another health system I was working with. We asked the questions more about health, are we as a health system meeting your needs and supporting you in health every day? And the answers are very different than, are we providing appropriate care? So to what extent do we plan to kind of delve into that and really explore, are there completely uncharted territories that we're not even in? My concern is if the questions are just about more traditional care, we'll miss those types of insights. And by way of example, when we were asking, one of the cohorts we were looking at were new moms, and the answers are really, really blatant. You're doing nothing to support my health every day. I'm getting all the care that I need, but as a new parent, I have no help, getting exercise or preparing meals or, all these things that are the social drivers of health. So I hope that we're asking questions in a way that pulls that information as well.
There will come a point where the survey that we currently have will have run its life course, and I think that's going to happen pretty quickly. And then we can repopulate it with new questions. And so I would love to work with you to see some of those questions and figure out what our next iteration looks like, because I think that would make a ton of sense. And I love that suggestion. Thank you.
Michael, I thought along the same lines is how, if at all, are we dovetailing with our community health needs assessment? Is there a connection?
Yes, absolutely. I'm working very closely with them. Yes, and Dr. Dozenkavich and I are both participating in that task force to make sure that what they're doing both follows the strategy that we're talking about and doesn't duplicate the work, right? There's just not enough people for us to be duplicating work, so that's a super important thing. But yeah, I've been meeting with Maria and Lizzie on a regular basis.
Okay.
Wonderful.
Yeah.
Thank you. Any other comments, questions from the board?
No, I look forward to
No.
seeing it, yeah.
It's something that we're not going to see results from right away. This is going to be collecting and then analyzing and then coming up with some ideas and then collecting more information. So I hope that we have the tenacity to stay with it and keep going until we get kind of the information that will really be helpful to our residents.
You will be able to go into the tracking document anytime you want and page through the comments that are there if that is something of interest to you. But this will be one of those things where we can't leave the analysis of it to the end because it will become overwhelming. So we will do it as we go along.
Alice, I agree with the tenacity, but I was scrolling from past board notes because that's what I like to do. And I just want to say, thank you. I think, yes, it's a lot of work. I want to thank Ted, Jen, for the work that you have coming up. But even going back and I was like, when did we start this? Looking at September and looking at our slide of the initial outreach rollout, October to December 2025. I'm like, oh, geez, you guys got all of them. Initially I was very impatient. I'm very grateful that we did the QR code at the football game. We learned a lot, understood what was going on, but there was quiet time over the holidays, and I didn't go back to this slide to realize how much it needed to be built. So I want to thank, it's quiet, it's work that's done all the time, we don't get to hear it. So I'm very excited as I look to January and March of active listening, look forward to it as well. So look forward to that March discussion and what we find, and thank you for that access so we could look at that information as well.
Fantastic. From the audience, any comments, questions? All right, hearing none.
Thank you so much.
I won't volunteer anyone else here, but you just tell me where you need me. I couldn't be more excited about this. You just point me in the direction, and I'll go stand on street corners. Yeah,
We'd also love
this
your
is so
help bringing
exciting.
groups together. If you have a group of friends who would love nothing more than to sit over a cup of coffee and talk about healthcare, I will be there. So let me know.
Oh, I'm going to take you up on that.
You got it. You got it.
I got to tell you, I'm a member of this Squaw Valley locker room, members locker room, and on weekdays, I don't think there's ever been a day that I haven't had one member come up to me and say, hey, by the way, I need a new knee or my this or that or whatever. I went to the hospital the other day. So I'll be calling you for that.
Yeah, and this is, you guys are some of our most high-profile contacts for the health system, right? And so this is why your part of it is very important. So I look forward to the partnership.
Can we get some more of
Yes.
these as well?
Yes, look at them if you.
Book clubs,
Yep.
you know.
If you have any changes you want to see to them, now's the time to let us know, maybe by Monday. Otherwise, we will do a bigger run, and we will get you packets of as many of them as you want.
Kim?
Maybe when we pick up our computers.
And of course, rest of team, recognize there's a lot of people working on this. Thank you, thank you, thank you. An incredible effort.
Yeah.
Super exciting. Moving on. Item 15, there were no items pulled from the consent calendar, so we will move on to any board committee reports. I know we had a finance committee. Any other committee activity in the last month?
Okay, yes, well.
All right, Mary?
Yeah, well, the Finance Committee met on Tuesday, and as always, we started the meeting with a report from the company Chandler Asset Management, who manages our portfolio. For me, it's always so fun to start the meeting with a discussion of the national economic indicators and, you know, what all of that looks like. But the purpose of talking with them is to meet about our portfolio. So I want to tell you that we are in compliance with all of the parameters that we put around their management, and within those parameters, we are beating the benchmarks that we established at the time as well. So, so that's all really good. I remember back, well, it would be exactly a year ago, because it was when we started with the new presidency. And I remember the discussion that we had back then, and Chandler said that they were planning for the unknown. And I think here we are a year later, and it's still kind of an unknown, but they're continuing to plan. And they have all kinds of contingencies and what have you. I feel very confident that they'll be able to respond and react to whatever comes down the pike. So that was a very valuable discussion. We also talked about the accounts receivable. They haven't changed much within the machinations that they go through from time to time. And we had a bad November, and they're recovering now. But this conversation that we had around the accounts receivable led to a really lengthy discussion that we had about onboarding of providers. There's a tremendous time lag between when we bring a physician on board and the time at which we can actually receive compensation for the care provided by that physician. And it has to do with having that individual recognized by the insurance companies, by the government payers. Correct me if I'm using the wrong terminology here, Crystal, so what have you. But it's a tremendous lag time. And something that I learned that also is, I think, quite interesting is that provider is associated with an address and approved at that address. So if that provider moves to a different location, we have to go through this process all over again, this lengthy process. So all of this really big discussion because of all that's going on with the opening of the Gateway Center and the movement over to Rite Aid. There's nothing that we can personally do to truncate the process. The process is what the process is. But what is within our control, we hope, is that we can coordinate with the other departments, that we can coordinate with HR and med staff and the IT office and the business office and what have you, in such a way that we can expedite the process, because it's going to have huge ramifications on our accounts receivable if we don't. So just kind of a heads up about that. What else did we do? The financial reports are in your packet, and they've been approved and what have you. So there's nothing much to say about that. But there was a graph included in the Finance Committee packet about the payer mix. And it was, again, something that bears watching in that for the first time, we've had an inflection, or actually for the last 2 quarters, we've had an inflection between our Medicare population and our commercial population. We don't know at this point in time if that's a result of the late snow or if there's some external environment that has created that inflection. But it's something that we really need to keep an eye on because it's going to have an effect on our net income. So that was something that we talked quite a bit about. We also had another lengthy discussion. I want you to know this meeting did run overtime.
Yeah.
And this had to do with the federal and state Medicaid and Medicare reductions. There's a myriad of ways that the state and federal governments are attempting to reduce their spending on Medi-Cal and Medicare respectively. The things that I had no idea about, and it had to do with enrollment. Somebody mentioned at the meeting that a new qualifier out there has to do if you own a house that's valued at $130,000 or more.
It's called the asset test.
The asset test, you're disqualified.
They put it back in place where there was no asset test.
Yeah, okay. So there's so many different ways now that people are being taken off the rolls, and we just don't yet know where that's going to fall. It's such a fluid situation right now, and it's moving and changing all the time. But we talked a lot about the need to get these, to quantify this as soon as possible and get it before the board. And so I think that my closing note will be that we want to get it out there and get your input on it. So more to come. Did you have anything you wanted to add, Michael?
No, other than there are very few health systems that would draw a correlation between payer mix and late snowfall. But there you go, you did it.
Late snowfall.
Yeah.
Or no snowfall.
But it is a reminder that we're in a very unique operating environment, for sure. Thank you for that update. None others?
We had our monthly Incline Village Foundation meeting last week, and Anna and I brought them up to speed on issues involving the hospital in total. And for those of you who didn't notice, in the packet we all approved a new board member to that board. I have yet to meet him. Have you met him? I haven't met him.
Yes, Mr. Craig, and if you didn't meet him, you might have seen his video at the Best Of. He was featured at Best Of, and spoke.
That's the guy. Okay.
That's the gentleman.
I didn't put 2 and 2 together. Anyway, there's still a tremendous amount of energy and capability in that board, and it's an interesting one to be a part of. I enjoy it.
Thank you, Dale.
If you'll give me a little latitude, I did go to the CHIP meeting, and then since it's part of a community engagement, I'll add.
Please.
I've been so grateful to be invited to the CHIP task force meeting, which has several meetings throughout the year. We, as a board, will be approving the CHIP plan in the summer. And so this one really covered, again, I think, Dale, to kind of answer your question of like what other things outside and Michael as well, when you talk about healthcare and health, with a deep dive into mental health, substance abuse, food insecurity, transportation, this was the topics that were discussed with follow-up meetings more in depth in these as well. So really understanding, and again, this meeting has all the community members that play a role in this, from Health and Human Services, the Recreation Park Department, United for Action, the Tahoe Transportation Management Association. So you can imagine just a flavor of all the people are at this meeting. So just add to the community, it's really is that outside part as we look into the healthcare and we're getting the input. It is fascinating, and I heard Kim mention that it is part of this great work that they're doing to hear the community voices. So more to come.
Wonderful. Thank you. Any other reports, closing comments? With that, We'll wrap a little early tonight. Meeting adjourned. Thank you, everyone.
Thank you.